Stacy again from Hillside, and I wanted to show y'all our pharmacy area. So we're going to start with a little tour. So here's all of our heartworm preventions, flea and tick preventions. And then we come over here with our antibiotics and our NSAIDs. And then we have all of our ear and skin stuff here. And then here is some more antibiotics, and we got heart medications. And then we have some steroids and everything over here. And then this is our lock. This is where we keep all the controlled substances, so everything's locked in here. And then just some of the kind of safety stuff that we use here, especially when dealing with drugs that you need to have gloves on. So these are those drugs, and we like to label them with all of our stickers, and it specifically says use gloves when administrating. So I'm going to show y'all how we do our meds, fill our medications. So we're pretty fortunate here at Hillside. We are super busy, so we actually have a pharmacist in here, usually one or two at all times. And so our doctors and the technicians, whenever they put in the orders for the pharmacy, they'll come out on our little prescription labels here, and then they'll come in, find their medication, and then they'll fill it. And then we have all of our different containers here, and then we have all of our stickers. And then, like I was showing y'all earlier with the stickers, we do like to place the stickers for whatever the medication needs on the labels here, so we know exactly which stickers are needed for the medication. And then here's like an example. Here's their fluconazole. So it's 1 tablet once a day every 24 hours with food for the yeast infection. So then we do the give with food. And then just another safety of how we make sure that this is the right medication. We like to have 2 signatures. So the person that is originally filling the medication, and then the person that comes back and checks and makes sure that's the right medication, right dose, right amount, and then the right patient. And so that's how we have our little 2 signatures there. I'm going to talk with y'all a little bit more about our calculations that we have to do in pharmacy. So for example, the doctor prescribed Panicure. So he prescribed 48 mils of Panicure, and then he wants to give 16 mils at a time. So then you have to do the division there, and then it comes up with 3 different vials of the medication that we're giving. And then another example for some of the calculations that we have to do. This is our ear medications. So sometimes the doctor wants a very specific ear medication, and so we have to calculate and make the formula just as it says on here. I wanted to show y'all is whenever we have people call in prescriptions, we do have our bins down here, and then they're alphabetical organized here. So whenever the client comes in, we have a drive-through. They can come in, they say they're here to pick up Fluffy's prescription, and their last name's English. And then we come in and we find their medication, make sure that it's double signed, and then we can give it to them. And then for all of our preventions here, we sell a lot of prevention here. So we do have our labels here, our alphabetical, and then we can just find their last name and then fill that prescription. And then let's say if they're picking up a controlled substance, we also keep that in this safe, in the controlled safe, which only a certain amount of employees here are allowed access to that.